In this lecture, we will discuss the standard 12-lead ECG, including its basic layout and the temporal relationship of leads to one another. The electrocardiogram represents a three-dimensional image of the heart's electrical conduction system. As its name implies, the standard 12-lead EKG is broken down into 12 leads or views of the heart. It consists of 6 limb leads and 6 precordial leads. The 6 limb leads are leads 1, 2, 3, AVL, AVR, and AVF. The letter A stands for augmented because these leads are calculated as a combination of leads 1, 2, and 3. Okay, so we have our limb leads here, and notice them, they are on the left side of the EKG. All right, the 6 limb leads, 1, 2, 3. Then we have these augmented leads, AVR, AVL, and AVF. Then we have the 6 precordial leads, which are leads V1, V2, V3, V4, V5, and V6. Okay, so V1 through V6, and the precordial leads are here on the right. So V1, V2, V3, V4, V5, and V6. Oftentimes, the EKG will also include at least one rhythm strip at the bottom. Okay, here's our rhythm strip. Down here you may see more than one, and it's from this point and it stretches all the way to there. Okay, so that's a basic overview of the standard 12-lead EKG. Now, the EKG, the standard one, represents a 10-second window of the heart's electrical activity. So the whole duration of the EKG from left to right represents 10 seconds. And if there are 4 leads shown going across horizontally, that means there's 2.5 seconds within each lead. So what do I mean by that? Okay, so in this rhythm strip going across, this represents 10 seconds of time. All right, you can see it down here. And what we're saying is that each one of these is broken up into 4 different ones going across. Okay, so here's lead 1, AVR, V1, and V4. Okay, and we said time is going across. All right, and when we go up, we're looking at voltage. So if we're going across and then we're broken up by, the whole thing is 10 seconds, 10 seconds over 4 different leads gives us 2.5 seconds for each lead, meaning from this point to here is 2.5 seconds. Again, from here to here is another 2.5. This lead is 2.5, and this is 2.5, okay? So 2.5 seconds within each lead, and the whole total duration is 10 seconds. All right, now it's important to be aware of something called temporal relationship on the EKG. So what do I mean by this temporal relationship? Well, I mean that if we were to draw a straight edge down in like a vertical line, which we have represented here in red, the events that are touching that red line occur at the same time. That is to say, everything directly above and below a point is happening simultaneously. This should make sense because we said that moving horizontally left to right across the EKG paper represents time. So this temporal relationship is one of the main things I want to discuss. And notice that we have, let's just erase some of this here. Okay, so you can see what I mean. So what we're talking about with this temporal relationship is that, remember, time is going horizontally as we move from left to right across the EKG. This temporal relationship, if we use this red line here, everything occurring on this red line, okay, so this line here is happening at the same time, okay? So imagine this is 0 seconds and this is 10 seconds, so maybe this is 1 second. So everything happening here is happening exactly at the same time. Now, just so this is clear, the events that occurred in lead 1 did not occur at the same time as those in lead V1. However, the events that occurred directly below lead V1 in lead V2 occurred at the same time. Okay, so if you have lead 1 here and lead V1 here, obviously lead 1, right, is from 0 to 2.5 seconds. So that did not occur at the same time as that from here 5 to 7.5 seconds, okay? However, if you take a look at lead V1, it's directly above lead V2, okay? So imagine we have something here occurring at 8 seconds, also at 8 seconds here. So this occurred exactly at the same time, all right? And this complex here is occurring at that same time as this complex. So we call this a temporal relationship in the EKG. Now, this temporal relationship is really important to be aware of, and it shows the importance of the rhythm strip. For instance, imagine we have a normal rhythm in the first 2 columns of the leads. And then in the third column, that is leads V1 to V3, there are different complexes, okay? So let's just erase some of this here so we can see what we're talking about in this point. Okay, now we're talking about this rhythm strip and showing its importance. So imagine that in these first two columns, so that means from here to here, everything is normal. Okay, now let's just say in this third column here we have V1, V2, V3, we have these complexes that occur that are wide. Okay, imagine that we have these wide complexes that are occurring, and they're also occurring down here in the rhythm strip, and then it goes back to something that's normal. Okay, so this third column here is represented as these wide complexes. Now, if we didn't have the rhythm strip to show these bizarre wide complexes, we could easily misinterpret it. So having this rhythm strip will make us take into account the morphology of these complexes in different leads, and also give us more valuable information to make a correct interpretation. All right. So the main thing here is having this rhythm strip. All right. Imagine it being lead 3 in this case, or say it's lead 2. Okay. Well, while this is occurring between 5 and 7.5 seconds, and we don't have lead 2, so if we had lead 2 as a rhythm strip, we would know what was going on in lead 2 between 5 and 7.5 seconds. You will soon see that this temporal spacing is critical in determining rhythms, intervals, ST segment changes, premature complexes, and aberrantly conducted beats. So make sure to factor in the rhythm strip when you interpret any EKG. Okay, let's briefly review what we discussed before we end. So again, the standard 12-lead EKG is made up of 6 limb leads and 6 precordial. The 6 limb on the left, the 6 precordial leads on the right. The limb leads are 1, 2, 3, AVL, AVF, and AVR. And the precordial leads are V1 through V6 as we go from the right to the left side of the precordium. Then there's often the rhythm strip. There can be more than one rhythm strip as well. The total duration of the whole EKG is 10 seconds. That means that each of these leads represents 2.5 seconds of time. And then we talked about this temporal relationship, meaning everything directly and above something on the EKG occurred at the same time. Well, that's the end of this lecture. We discussed the standard 12-lead ECG, including its basic layout and the temporal relationships of leads to one another. I hope you learned something.